Good morning, friends and friendly. This is yours truly, Dr. Valerie Mukanga from Healing Wings Dental, the place where we help you maintain or regain your oral health so that you may soar in life. So today I'm here to talk to you about why you would need a deep cleaning. There are many people who come to the office and, we do the exam, we do the x-rays, we would do the x-rays, do the exams, and then we tell them or we diagnose and see that they do need a deep cleaning, and we talk to them about it, and they say, well, isn't it just possible for me to just get a regular cleaning? Or sometimes I don't want a deep cleaning, I just want a regular cleaning. Or many people come and they say, oh, I heard my friend, they had a deep cleaning, and then their teeth got messed up ever since. They experienced this and that. So what is truly the reason why somebody would need a deep cleaning? So how do we even know that somebody may need a deep cleaning versus a regular cleaning? So anyway, first of all, a regular cleaning is something where the dentist is going to use their tools, their instruments, in order to clean all the surfaces of the teeth that are mostly above the gum line. And so the dentist will be removing plaques, they will be removing stains and things like that. So that's what a regular cleaning consists of. And after having done that, your teeth will be polished, and you'll be on your merry way. That's a regular cleaning. So why would somebody not benefit solely from a deep cleaning or from a regular cleaning and need a deep cleaning? One of the reasons is that they would now have, instead of just having debris and plaque on the surfaces of the teeth that are above the gum line, they have hard plaque even below the gum line. And so then what happened is that we definitely have to go below the gum line and remove all the hard plaque known as calculus. If you leave that, you will be causing problems. You will start developing even more problems to yourself. So I remember one time I was really young. I was still a kid in elementary school, and after school, after having eaten, I went on to play with my bike. And after I played with my bike, I hurt myself, and I ended up having a deep wound if in my foot, and so in my leg, in my leg around the ankle area. So my mom, being a nurse, after she came, I mean, what we did is we just cleaned it up and put a bandage on top. After coming from work, my mom, who's a nurse, I told her about the wound, and she looked at it and she noticed that it was really deep. And so what she did is she opened it up, she removed obviously she had removed the bandage in order to see what was going on and assess the problem. And she now proceeds to take all these things like gauze and all, and she went deep, with lots and lots of alcohol, cleaning with deep inside of the womb. And it's good she did that because it would have avoided, me to have an infection. I've seen many people who have abscesses after having had wounds, and that also happens in the mouth. And what has to be done is you can't just clean the surface or the top surface. Otherwise, you can start developing infection, having pus developing, and we understand that. So it's the same thing as I said, it can also occur in the mouth. In fact, I have seen people who've had infection in their gum that was not necessarily even due to a tooth, and you can actually extract pus. When you apply pressure, you start seeing, this pus coming out of your gum line. And yes, you may think it's very yucky. That's an extreme case, right? Where you would need to have a deep cleaning to remove, a separation or pus that you can see forming under your gum. So the hard plaque, though, has been lodged underneath the gum surface, and if you try to dislodge it, it's going to be very difficult. It's not only going to be very difficult, but also very painful. So that's why we use special tools. So what we do is we have to first numb you so that you can be comfortable, and then we're going to start removing the hard plaque that is forming underneath your gum line, and obviously also on top of your gum line. So we do that, and that's where you need a deep cleaning. So as I explained to me what happened if my mom did not actually clean my wound, it's the same thing with the mouth. A dentist has to remove the hard plaque, otherwise the hard plaque is going to continue to choke the area, choke your gum, and all the circulation, and and cause infection and inflammation. And so what's going to happen is that the gum tissue is going, and also the bone that support the teeth is going to try to like kind of run away, from the infection area, and you start having receding bone level, receding gum. So in order to prevent that, we do the deep cleaning, and we remove all that debris and clean very good. Sometimes you may need to put some antibiotics beneath your gum, and sometimes we can also give you medicated mouthwash. Most commonly we give you chlorhexidine, also commonly known as Peridex, that you're going to be switching around twice a day after you have your meal, so as to decrease the bacterial load, and those are bad bacteria that actually adversely affect your gum. So that's the reason why you would need a deep cleaning. If you do need a deep cleaning, you don't really just qualify for a regular cleaning, because otherwise you will be leaving all the gunks and everything that is actually causing inflammation or infection at your gum line. So the good news is what? The good news is that once you do need a deep cleaning, yes, you will need to have your teeth cleaned more often. Oftentimes we recommend for someone to come every 3 months or maybe every 4 months, so that your gum can be reassessed and re-cleaned on a more regular basis. But as I was trying to say, the good news is that I've seen many patients whereby after having done a deep cleaning or many deep cleanings, and also they learn how to take care of their teeth at home, I've seen cases where they ended up, the gum becomes healthy and they no longer need deep cleaning. So that's a good news. Another thing is that the patient, if it continues, they may need to have gum surgery, and then things will get to a more healthy state. So there's hope. There's hope for somebody that is in need of a deep cleaning because they have gum disease, either gingivitis or periodontitis. Gingivitis being infection of the gum, and periodontitis being infection of the bone that supports your teeth. So that's what I wanted to really talk to you about. So if you go to a dentist and they tell you you need a deep cleaning, please don't fight them. It's accurate information, and it is for your benefit, so that you don't end up just carrying inflammation around that can also affect the rest of your body. That is essentially what I wanted to talk to you about today. So that being said, I really want to wish you a very great day. If you have found this information to be very helpful for you, please don't hesitate to share it with your friends and family. And also, if you don't have a dentist that you need to go to and you are in our area, we are Healing Wings Dental. We are located at 4101 West Greenhouse Boulevard, suite number 317 in Arlington, Texas. Zip code is 76016, and that's in the big city of the big metropole of Dallas Fort Worth area in Texas. And you may also give us a call at 972-213-0202, or you can find us and try to secure an appointment on our website, www.healingwingsdental.com. You can find us on our social media handle, Facebook, Instagram, also on LinkedIn and YouTube, where you can find more interesting information that could help you as far as your oral health. That being said, have a great day. Bye-bye.